I'm Sarah, and if you're a parent of a child with autism, or you know someone who is, today's episode is probably something you've been waiting for. We're talking about stem cell therapy as a potential treatment for autism, what it actually is, what the research says, and what families need to know before they go down that road. I have with me Dr. Evans, who specializes in integrative medicine and has been following this space for years now. Dr. Evans, really glad you could make it.
Thanks, Sarah. Yeah, happy to be here. And look, I'll be honest, this is one of my favorite topics to talk about because I get families in my office almost every single week asking about this. So I'm glad we're having this conversation in a place where more people can hear it.
Yeah, and I think that's exactly why we wanted to do this episode. So let's just start from the beginning because I know some of our listeners are just now getting introduced to all of this. Can you explain what is autism and why is it so difficult to treat? Like, why haven't we cracked this yet?
That's such a good question. And honestly, the answer is kind of humbling, even for those of us in medicine. So autism spectrum disorder, it's a neurological and developmental condition. And the key word there is spectrum, because it truly looks different in every single child. You might have one kid who's nonverbal, very sensitive to sounds and lights, and then another kid who's highly verbal but really struggles with social cues and forming friendships. Same diagnosis, completely different experience. And the reason it's so hard to treat is that we still don't fully understand what's happening at the biological level. There's no one gene, no one cause. It's a combination of genetic and environmental factors that we're still piecing together. So most of our current treatments, behavioral therapy, speech therapy, they're amazing tools, but they're managing symptoms, not targeting what's going wrong underneath.
That makes total sense. So then, where does stem cell therapy fit into all of this?
Right. So this is where it gets genuinely exciting. There's growing research suggesting that a lot of children with autism have what's called neurological inflammation. Basically, the immune system is overactive in the brain, and that's contributing to some of the symptoms. Stem cells, particularly those sourced from umbilical cord blood, have this remarkable ability to recalibrate the immune system and reduce that inflammation. When you calm down that chronic neuroinflammation, some neural pathways that weren't connecting properly start working better. Families report things like improved eye contact, more spontaneous speech, better emotional regulation. The mechanism makes real biological sense.
Okay, and I have to ask the question every parent is thinking. Are families actually seeing this in real life? Is this just lab data? Or are there actual kids who've gone through this and come out the other side doing better?
Some are, yeah. And I want to be really careful here because I never want to give false hope. This is not a cure. I can't stress that enough. But there are published studies in families who've documented real, meaningful changes. Better eye contact, initiating conversation for the first time, fewer meltdowns, sleeping better. There was a notable study out of Duke University that showed statistically significant improvements in social functioning for children who received cord blood treatment. So it's not just anecdotes anymore. But every child responds differently. Some show dramatic improvements, some modest, some not much at all. We need more large-scale trials before we can say anything definitive.
That's really important context. For families looking to access this, I know a lot of them have found a platform called PlacidWay. Can you explain how that kind of thing works?
Yeah, so PlacidWay is essentially a medical tourism facilitator. They connect patients and families with accredited clinics around the world, places in Ukraine, Thailand, India, Mexico, where stem cell therapy for autism is available right now. Because in the US and many Western countries, it's still not approved for this specific use outside of clinical trials. PlacidWay helps families navigate finding the right clinic, understanding the treatment protocol, logistics of traveling. That can feel overwhelming, so having a platform organizing that is genuinely useful.
I can imagine. Traveling internationally with your child for a medical treatment, that's a lot. What do you tell families who are nervous about that step?
Honestly, I validate the nerves completely. My first piece of advice is always, do not rush it. Research the specific clinic thoroughly. Ask for the doctor's credentials and their experience with pediatric stem cell treatments specifically. Ask about follow-up care, because the work doesn't end the day you fly home. Ask for references from other families if they can. And if a clinic is making promises that sound too good to be true, run. Any reputable provider in this space is going to be very measured about what they can and cannot guarantee.
Such good advice. Last question. What's your overall message for a parent sitting there right now, feeling a mix of hope and overwhelm?
I'd say this: your hope is not naive. It's grounded in real science that's moving in a meaningful direction. But hope and patience have to go together here. Stem cell therapy is genuinely promising, and for some families it's been life-changing. But it works best as part of a comprehensive plan, not a replacement for the therapies already building your child's skills every day. Keep doing the work, keep the conversation going with your care team, and if stem cell therapy is something you want to explore, go into it with open eyes and good information.
That was beautifully put. Dr. Evans, thank you so much. I feel like every parent listening just took a deep breath.
I hope so, Sarah. That's all I want, for families to feel informed and not alone in this.
And to everyone out there, thank you for tuning in to Health Matters. If you want to explore PlacidWay's network of clinics, we'll have the link in the show notes. As always, please talk to your child's doctor before making any medical decisions. Take care of yourselves, and we'll see you next week.